Hey guys, it's Dr. Emer. We're in West Hollywood and it's the beginning of the week and we're doing some great filler treatments today. I'm super excited to have a new patient here of mine because she is a great example of needing just a little bit of contouring, nothing crazy that needs to be done to give her an enhanced look, something that's brighter and more definition and gives her that more youthful appearance. The other thing long term is we're going to work, this lifting is also going to help the appearance of her scars. And she's had some acne scars for a really long time that's made her a little self-conscious. We're going to work on treating those using energy treatments, peels, and lasers. But our initial starting point is to get a little lift and a little bit of shaping. And if you take a look at her face, for example, the biggest, everyone wants this type of nice contour jawline, but she's starting to get some hollowing under her eyes, some puffiness there, and some drop in the tissue. So we want to lift the tissue. Now, as you guys know, we can't fully lift tissue with fillers, but I can give some definition that gives the appearance that it's more lifted. So we're using Volluma, and you can see already just on that little bit, it's giving her more of a contour, and that contour is going to disguise her face into being a little more defined, a little more lifted. It actually does help pull back the tissue so the folds improve. So we're working on that little crease in that central area below her eyes. And then also what we call the submalar area. Now, typically people need more than one syringe aside, but this is a good starting point, and she's gonna see some definition pretty quickly from it. And then we'll work to give her some eye improvement as well. But this will support her under eye. Lay back, you're doing great. You can see already, take a look at the one side. It's lifted and defined here, and it's not as much on the other. So now we're gonna go towards, again, this side here, really focusing on the area she needs lifting. So we follow when she's smiling. Smile as big as you can. Perfect. And we're gonna relax. We're gonna go right to that upper lateral area where women need a little more definition, and doing just small baby aliquots right on the bone will give a nice improvement. We're not overdoing it. We're doing really subtle amounts. And this is what people traditionally call liquid facelift. This is what I call the without a trace lift, because this is going to give her lifting and contouring without anyone knowing she really had anything done. And my patients want subtle. So the goal here is to really give her a subtle improvement where she can go and get, see friends and no one really knows that she had anything, but she knows we did some treatments and she looks better. And that's my goal with this. So this is initially our mid-face lifting. We're giving some volume here to that middle face. We'll take a look now at both sides. She's doing great. The mid-face is pretty much completed. We have to work now on a little bit on the folds and a little bit to the under eye. So already, look, we have a nice lift and contour, and notice how her folds have improved. So we're gonna go to her folds using a little bit softer filler, but has volume as well, called velour. And velour is a little bit more of our, what I call the elegant filler. This lasts about a year, but it's really nice for folds and for lines and under eyes that we're gonna use it for, so that it blends, but it doesn't look overdone. You see here, she's got a nice sort of shaping towards her lateral cheek. I'm gonna go a little bit further back and give her a little more lifting here.
Does the patient feel pain?
How are you feeling?
Great.
Is it like little pinches at first?
Just little pinches, no pain.
Great. And our idea here is just to give a little bit as well to the under eye, so that the bags don't feel as noticeable and they blend more towards the now elevated cheek. So again, now the cheek is more elevated, the midface has more volume in both the apple and the submalar area and the lateral area and the folds. The other thing about these fillers is I find that Vicross technology fillers, which are these Juvederm fillers that are more newer age, like a newer iPhone, they look better as time goes on. So even in a few hours from now, they do something to the tissue that just makes the tissue look so much more natural. Even a half a syringe like we're doing here in this area, very little, And then again, to give more under eye support, we've already done some cheek elevation. Now let's go a little higher and give her some under eye improvement. You know, could she go have surgery for eye bags? Could she go have surgery to lift? She can, but by doing this, what we call the without a trace lift, where we use fillers, threads, or lasers to kind of lift the face, we can get a nice improvement and make her look like she's had, just looks better, looks more rested without anyone knowing. You know, and then we're gonna go to the submalar area, just a small amount. And I'm kind of going a little more superficial here because there's scars, just to make the scars look a little better too. Great.
What kind of filler are you using again?
So that one was velour. That was my finessing filler for her under eyes, her folds, and her submalar area. And then we used Volluma on the bone to lift. So I'm gonna show her, let's do a little Emer reveal. Can you let's wipe her off, let's get her nice and clean. Can you actually give her the phone? I'm gonna give you the phone. Take a look with your head back like that, because holding it up, just take a look yourself. Okay. Holding it up, looking at yourself when on an angle, always shows more of the contours. So take a look, tell me what you think.
Oh, I see it.
Way more lifted, a little more volume through here so you don't have that crease. And then I went a little higher. Now some of the puffiness here is the actual bags. Mm-hmm. You don't want to overdo those. Eventually we'll work our way more laterally and build a little more. But the folds, submalar area, and cheek contour. Look to the side. I see it already.
It's an immediate.
Look to the side. Nice lifting. Look to the other side. Nice lifting. When you smile, that's the key. Smile. Not too puffy here, but it's soft. You need to have a natural crease, but you want some definition. Mm-hmm. So that's basically mid-face. Oh, that looks really good.
It does.
It does. Show, different angles show different things. That's why I also want to show you. We're going to take that back, show you in the mirror. So you can take a look in the mirror itself.
Oh, yeah.
So take a look there.
Well, I can already tell the difference here. Look at that.
Yeah, and then eventually we'll work our way up even higher and higher with the filler, but you want to not be overdone. When you do filler initially under the eye, there's a tendency for it to want to get swollen. It's a mixture of the blood circulation in the area plus the filler holding some water, swelling. So you give it a little time, a few weeks, we add, we build. So long-term patience is what we're looking for. So female facial sculpting, mainly mid-face without a trace lifting of the cheek and improvement in dark circles. What do you think? I love it too.
I have cheeks.
It looks really good.
Thank you.
Have a good day, guys. No, it looks great. And then we're going to put you under a red light now.